In this video, we're going to look at lower hamstring tendinopathy. So it causes pain around the back of the knee, usually either to the inside or the outside, but if you have it in all your hamstring tendons at the where they're attaching to the knee, it can be on both sides. Now, we're going to look at what the typical symptoms are and how you diagnose it, because there are quite a few other conditions that can cause pain in a similar area. And then we'll look at the treatments, including what exercises you can do, and I'll demonstrate exercise that's appropriate for different stages of recovery. And we'll also look at why some people's recovery may take several weeks versus others takes months and months. Now, this is going to be a long video, so I'm going to put chapters in the video so that you can jump to the relevant sections that's important for you. But if you're interested in getting the exercises, please do watch the bit about the things you've got to keep in mind before you just jump into doing exercises. For those of you who don't know me, my name is Marika. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. It's always useful to just quickly look at the anatomy of the hamstrings, because then you'll understand why specific rehab exercises are prescribed as they are. Now, you have three hamstring muscles and they run at the back of the thigh. Your semimembranosus and tendinosus are more on the inner side of the thigh, and then you've got your biceps femoris that's on the outer side of the thigh. The biceps femoris has two heads, so you could think of it as two muscles, but for this video we're going to think of just three muscles in total. So if we look at where they run from, your semimembranosus and semitendinosus originates from your sit bone, so that bone you can feel there, runs down the inner back part of the thigh and attaches to the back corner of the knee there on the inner side, and then also comes around and attaches to the front of the tibia. Then biceps femoris comes from the sit bone, the long head. Short head comes from about a third down on the femur, and they run down the outer portion of your thigh and come and attach to the back outer corner of the knee, as well as around onto the fibular head. And if you flex your leg against resistance by pushing your heel into the floor, you can feel those tendons tense there. And those are the ones that's affected by lower hamstring tendinopathy. Now, you also have bursas in that area where the hamstring tendons are close to the knee joint. A bursa is a little fluid-filled sac, and its job is to protect the tendon from the bones, from the friction of the bones. And this is significant because often when you have an injury to your lower hamstring tendons, you also irritate the bursas in those areas. Now, something to take note of is if your knee is bent, there's less compression between the lower hamstring tendons and the knee joint or the bones there, so there's less pressure on the bursa. When your knee is straight, there's more pressure between the bones and the tendons, so there's more pressure on the bursa. This is important to keep in mind for your rehab, because often during the early stages, if everything is still sensitive or you have a bursitis, it can be better to do your rehab exercise with your knees in a more bent position. So we avoid that major compression when the knee is more straight. Of course, towards the end of your rehab, we have to include things that compress the tendons a bit more, because that's part of normal movement. So how do the hamstrings work? It works in several ways. Because it attaches at the hip joint as well as the knee, it affects both the hip and the knee. Now, for the hip, it helps to stabilize the pelvis, anterior and posterior. It also extends the hip when it contracts. Then at the knee, it flexes the knee, so it bends it up. But as we walk and run, it also slows the extension down. So can you see if the hamstring is going to contract as your leg goes forward, it's going to slow it down that it doesn't go straight too quickly, and it stops it from overextending. It also has an important job at the knee, that it helps support the anterior cruciate ligament and stops the tibia from slipping too far on the femur. So what causes lower hamstring tendinopathy or tendonitis to develop? Well, you can get, depending on the cause, you can get either primary tendonitis or tendinopathy or secondary. Primary lower hamstring tendinopathy is caused by overuse. And this overuse can either happen suddenly in one session where you do a training session or an activity that's a lot harder than what your tendon is used to, and it just simply can't cope with that session. So typically you do a competition or you do a sudden training session or something that you've not been training for, take up a new sport, and that causes the tendon to overwork. But commonly is actually a gradual, slow overload where you just don't allow your tendon to recover enough between training sessions. This is the most common type. So we've got to remember what happens to our body when we exercise. We first, during that exercise session, we get micro damage in the body, and that's absolutely normal. It's your bones, your muscles, your tendons, everything gets a little bit of micro damage. And that micro damage signals to the brain that it needs to strengthen that part of the body. If you allow it enough recovery time, your body then strengthens and it's actually stronger than before. So you can now do more sport and more activity. And this is the process the body uses to grow stronger over time. Now, if you train again before it's gone through this whole cycle of repair, then actually you start accumulating the micro damage and becomes an overuse injury like tendonitis or tendinopathy. So this is the most common cause for overuse related or primary tendonitis or tendinopathy. So common training errors that can cause that is if you don't allow enough recovery time, do too much high intensity work, or for instance, if you have a sudden increase in the volume of training you do. Also, if you do sports that really use a lot of strong flexion extension of the knee. So we're thinking of running, both long distance running and fast running, or really high intensity cycling, speed walking, where you really throw your legs forwards as you walk. And also things like weightlifting or triathlon. So secondary hamstring tendinopathy develops because something else is causing the hamstrings to overload. So typically it's things like if you've had a knee replacement. Now suddenly there's a mismatch with muscle strength in the legs and the hamstrings have to overwork. Also, knee arthritis can cause that, or injury to your anterior cruciate ligament. Because remember, the hamstrings help to stabilize the knee joint that it doesn't slip too much. So if the cruciate ligament is injured, the hamstring tendons then have to overwork to compensate. Same thing for your medial cruciate ligament. Because the hamstrings help to provide some stability to the inner part of the knee, if the MCL is injured and chronically injured and you keep on training on it, then it can cause the semimembranosus or tendinosis to overload. And also excessive foot pronation is thought to contribute to that, because if your foot rolls in excessively, it places more strain on the structures on the inside of the knee because it's going to force the knee in as well. And that can cause the hamstring tendons to overwork. So what does lower hamstring or distal hamstring tendonitis or tendinopathy feel like? So the main symptoms are usually pain and stiffness. Now, some people only have pain, some only have stiffness in the tendons, and others have a combination. So it just depends on your case what you'll be feeling. The important part is that this pain or stiffness has to be located in the area of the tendons. If it's not in the area of the tendons, then it's likely not going to be hamstring tendinopathy or tendonitis. If it's your semitendinosus or semimembranosus tendons that's affected, the pain's going to be more towards the inner back corner of the knee, or even come around depending on which part of the tendon is affected. For the biceps femoris tendons, it will be the outer back corner of the knee, or it can be more over to the front, towards the fibular head, depending on which part of the tendon is affected. Now, usually if you contract or you do muscle knee flexion against resistance, that often brings on the pain. If you have a very mild case, it may not bring on the pain. If you just do a general contraction, you may have to load it up to actually get the symptoms. Now, typically, the symptoms start slowly and sets in slowly over time. If it's in one session, it's usually towards the end of the session you feel it first, or several hours after the session, or typically people wake up the next morning going, oof, my hamstring tendons feel really stiff and uncomfortable. If you get a sudden sharp pain or pop or something like that at the moment that you injure yourself, that's not tendonitis or tendinopathy. That means that you've likely torn something and you have to have it checked quite quickly, because it's you're going to need a different type of treatment. Now, if your tendon is not that painful or uncomfortable, then you may find that day to day you don't feel much discomfort at all. But it's only when you do a hard training session that you start feeling the symptoms towards the end of the session or afterwards. If, however, your symptoms have been dragging on for quite a while, you may find that it's painful just with general activities like climbing stairs or walking. Often also it can feel most stiff first thing in the morning when you wake up and start to move, or if you've sat still for a long period of time. That often also increases the discomfort and the stiffness, purely because you have less circulation then, so the fluid and things just accumulate. Now, at the beginning stages of tendonitis or tendinopathy, you can usually train through the pain. So you may feel it a bit during the beginning of the session, but then actually it goes away and it doesn't bother you until several hours later. But again, like I said, if it's been dragging on for quite a while, it will likely eventually stop you from being able to train, because it will just be too painful. It is also quite common for the hamstrings to feel weak, as if they just don't want to work, and it can make your knee feel quite unstable, because it can feel as if your knee just wants to go too far backwards. And that's because your hamstrings have an important function in stopping your knee from extending too far. So if the hamstrings are injured and they don't want to contract as normal, your knee may feel as if it just wants to go too far back. There are quite a few conditions that can give you pain in the same areas as you get when you've got lower hamstring tendonitis or tendinopathy. And it's important that whoever assesses you keeps this in mind and tests for all of this to exclude it or include it. So the typical type of things that can feel similar is if you have osteoarthritis in the knee, it can cause pain in any of those areas. Bone bruising is common in athletes, and that can cause pain in similar areas. Also, a Baker's cyst. Now, a Baker's cyst develops in reaction to something like a meniscus tear, for instance, and that can cause similar symptoms as well. Then calf muscle injuries, because your calf muscles, the top of the gastroc comes and attaches over the back of the knee joint, so that can feel similar. For the same reason, also popliteus muscle injuries, and then obviously also referred pain from the lower back, because the nerves from the lower back run right behind the knee as well. Now, for inner knee pain, things that can feel similar is a MCL strain, so medial collateral ligament strains. If you have an injury to the lower portion of your adductor muscles, or perhaps adductor bursitis, you can also have a lower hamstring bursitis. So those burses that's between the hamstring tendons and the knee. But to be honest, a lot of the time, bursitis goes hand in hand with the hamstring tendonitis. That's why you've got to keep in mind what you do in rehab. So if we think of outer knee pain, then things that can feel similar is IT band syndrome. So sometimes people get diagnosed with ITB syndrome and then actually it's lower hamstring tendonitis, and vice versa. Also, lateral collateral ligament injuries, so LCL ligament injuries or lateral meniscus injuries can feel very similar. Now, it's clear that there are quite a few things that can feel similar to lower hamstring tendonitis. So how do we diagnose it? How can you tell which is which? Well, first of all, your clinician has to take a thorough history of how your symptoms started. For instance, if you tell them that, oh, I felt a sudden sharp pain while I was exercising and that's how it started, then that's likely not going to be a tendonitis. That's going to make me think that, I think you may have torn something there, so we better get it investigated. But if you tell me that, no, the pain started slowly over time, I think I felt it first after a long ride on a bicycle, then that starts to fit the picture for tendonitis. Now, so you'll take a thorough history, you'll listen to how the symptoms react to different activities, because that tells you as well. And then you get the patient to do movement tests. So you'll contract the hamstrings against resistance or see what it feels like when you stretch it. And that can tell you, because if it doesn't hurt when you use the hamstrings, then again, you may think that actually it could be something else rather. And then thirdly, you may want to order special tests, but you don't always need scans. If you are going to get a scan, then an MRI scan is the best, because MRI scans can show you what's going on inside the knee joint. Is there a meniscus tear or something like that that may be actually causing the pain? But it also shows you the tendons and it shows you the bursa. So it shows you everything that's going on. X-rays are not useful. They can show you if there's little bony spurs and things, but they don't show anything except the bone. So you don't know anything about the tendons, the bursa, or what's going on in the joint. Ultrasound scans can be useful. They can show you the tendons, they can show you the bursas. What they can't show you is anything inside of the knee. So if the clinician who's assessing you thinks that you may have a meniscus tear that's at fault here, they'll rather get an MRI scan. If they have done the tests for meniscus tears and there's nothing to raise that suspicion, they'll rather go for ultrasound scans because it's quicker to do and you don't need the more expensive MRI scan. Recovery time for lower hamstring tendonitis can vary quite a lot. It can vary from about 12 weeks to get back to full sport up to 18 months and sometimes 2 years. Now, why on earth does this happen? So to understand this, it's worth understanding what happens in the tendon depending on when you seek help. So any tendonitis or tendinopathy can be divided roughly into 3 stages. Now, these 3 stages are not like boom, here this one stops and boom, this one starts. They do overlap a bit, but broadly speaking, the first time your tendon becomes painful, and within the first few weeks, we talk about acute or reactive stage of tendonitis or tendinopathy. And in that stage, the tendon is quite angry and irritated, and you have fluid that's come into the tendon, and you have lots of things that are producing pain in there. But we don't have much change to the structure of the tendon yet. So tendons are made up of lots of collagen fibers that's in parallel. And it's that parallel structure of how the fibers are aligned that makes them so strong. Now, at this point, you have a bit more fluid in there, but the parallel structure is still there. If you seek help at this point and you offload the tendon, allow it to recover, and then slowly reload it, that's the best chance you have of getting rid of this within 12 weeks and getting back to full sport. However, if you carry on with your sport and you keep on pushing the tendon, that this now carries on. So now we're about 6 weeks into pain or symptoms and you've not really sought help. You keep on, every time that feels better, you do sport and you just flare it up again. Then we're starting to see changes in the structure of the tendon. And what it shows under a microscope is that those fibers start to move further away from each other, they become a little bit disorganized, and you get a lot more fluid in between that. And as soon as the structure starts to change, we're losing strength in the tendon. Now, to change it back to a nice strong tendon or to strengthen the rest of the tendon up takes quite a long time, because tendons are made up mostly of collagen and they're slow in producing new collagen fibers and strengthening them. So if your tendon pain has been carrying on for a couple of months or so, then you're looking at a recovery time of more realistically something like 6 to 9 months, up to a year even. Now, if you've really neglected it and it's gone on for about a year or longer, then the recovery time is going to likely be at least a year, but more up to 18 months or 2 years. And that's just purely because there's a lot more stuff that we've got to address inside the tendon, and you're going to have to be doing consistent strength training for several months more before that tendon's going to be ready for your full sport again. So it all depends on how quickly you're looking for treatment and how much change has happened inside the tendon. When we look at treatment for lower or distal hamstring tendonitis or tendinopathy, there's very little evidence in the research because it's just not one of those conditions that's been well researched yet. So what I've done for this section is I've looked at the typical best practice for general tendonitis or tendinopathy. That's true for most tendons. I've also looked at the little bit of research we do have for distal hamstrings. And then what I found in my own experience with the athletes I've treated, what's worked well for them and what hasn't worked that well. So the treatments we're going to look at is we're going to look at relative rest and strength training exercises, because those are the 2 main things that seems to work best for all tendons. Then we'll also look at exercise for the rest of the body. That, by the way, I'll also demonstrate the rehab exercises for you for different stages of tendonitis. Then we'll look at the exercise for the rest of the body. We'll look at what exercise you actually may want to avoid when you've got lower hamstring tendonitis. We'll look at neural tension, and when I get to that, I'll explain a bit more about what neural tension is, and overpronation, because that can contribute sometimes. We'll look at shockwave, injections, and lastly, surgery. The most important treatment that you want to get right for your tendon is relative rest. Now, interestingly, what the research shows is that complete rest, where you just don't do anything, is not that useful for tendons, because it actually makes you lose more strength, and it can often make you feel more uncomfortable even. Or it can work really well at calming your pain down, but then as soon as you go back to sport, it flares back up because you've not actually done anything to help the tendon improve in the meantime. So the better option seems to be relative rest, where you don't stop everything, you just reduce the intensity or adapt the movements you do, or just stop the really aggravating activities so that your tendon can stay active but also be allowed to calm down. Because remember, when it's injured, it usually loses a bit of strength and endurance. So it can't physically cope with the loads you want to do. So if you're going to continue to try and train through it, then you're just going to make the injury worse. However, if you train at a level that doesn't increase your pain, doesn't increase your stiffness, then that level is set at the right strength level for it currently. So it's not getting injured further, it's just maintaining its strength. So how do you decide what you can do? One, it's absolutely fine to feel a little bit of discomfort while you're exercising. So if you do something you think, I can just feel my tendon, but it's not really painful, I'm not even sure, perhaps I'm imagining it. That's an okay level usually. We talk about 1 or 2 out of 10 pain or a slight discomfort. If, however, you're doing your activity and you think, oh, that's becoming really uncomfortable now, I would say that's probably too much and you've got to stop and do something else. Also, tendons have a delayed pain response. So it's fine to look at what you feel while you're doing it, but you have to check the 24 hours after an activity. What the research is showing is that likely, even if you have an increase in sensitivity after you've done the session, as long as it's not a very big increase, so it's just slightly more uncomfortable than normal, and it calms down within the next 24 hours. So next morning you wake up and you think, no, feels like it usually feels this time of the morning, then that session that you did yesterday was fine. However, if several hours later you think, oh, that's quite a lot stiffer now, or quite a lot more uncomfortable, and the next day it's still more sensitive than what it has been up until this point, then that's too much. That shows us that likely the session you did yesterday was too much and needs to be adapted. Now, the second most important thing in your treatment plan are strengthening exercises. And strengthening exercises are needed because it's the only way to stimulate the body to rebuild the tendon stronger. Now, before I jump into what exercises to do, there are a few things to keep in mind, because the strengthening exercise has to be tailored to your specific situation, how strong your tendon are at the moment, how sensitive it is, and the position can vary for different people. So I'm going to talk about that first before we jump into demonstrations of what exercises to do. Okay, so the basic principles of designing a rehab plan is, first of all, you've got to take the person's sport or activities into consideration, what goals they have. Because the movements you want to use for somebody who wants to cycle with high intensity versus somebody who wants to run may be quite different. Then the exercises that's prescribed should not cause an increase in pain. Like we spoke about a minute ago, it is okay if it's a little bit uncomfortable, but in the 24 hours afterwards, it shouldn't become really uncomfortable, and it should settle down. Whatever extra little bit of discomfort you had should settle down within 24 hours. It should also contain a mix of high load and low load days, because on the high load days, you work the tendon harder, so it then needs recovery time afterwards to rebuild itself. Because rehab exercise is just like all other exercise, and this is an overuse injury. So if you do too much heavy strength training, you're just going to overload the tendon further and it's going to get worse. So typically, for somebody who's perhaps not that fit, It may be that the high load is the strength training and the low load is just rest or recovery and not any exercise much or just moving around. Whereas somebody who's a lot fitter and stronger to start with will have a high load strength training day, and perhaps the low load may even include other strength exercises like isometrics. So it all depends on your specific case. The intensity of the exercises should increase over time to allow you to grow stronger to the point that you need for your sport. But you should only increase the intensity once you're fully adapted to the current load. So where I see people go wrong often is that they are so set on the targets they want to hit and the loads they want to get to, that they forget that actually the tendon takes a lot of time to adapt to the current load. So a rule of thumb that works quite well is that if you complete the session today, that seems relatively fine and it doesn't cause you increase in symptoms, don't immediately push the load up in the next session. Repeat that session one more time and then go up a little bit. I find that method gives the tendon properly time to settle into the new load, and it stops people from having flare-ups. Also, usually it works best if you start with exercises that avoid full knee extension or quite a lot of knee extension, because there's more compression in that position, and rather start with positions where the knee is more bent so that you have less compression between the tendons and the bursas and the bones, because that's tolerated more often. And then as the rehab progresses, you start working in straighter positions. Also working with quite stable exercises first, so supported on 2 legs, and later on moving to less stable exercises where you perhaps just supported on 1 leg. There are quite a large variety of exercises that you can use for rehab for lower hamstring tendonitis, but I'm going to choose the 3 most commonly movements used, because there are also things that you can easily do at home or don't need a lot of equipment for. And I'm going to demonstrate them for you for the early stages when things are really sensitive, and how you may want to progress them to get to the higher loads that can eventually get you back to your sport. So the 3 movements are bridges, hamstring curls and deadlifts. So if we think of bridges, then there are quite a few different ways in which we can adapt them to either load the hamstrings more or to vary the amount of compression you get at the knee joint. Now, it's often least aggravating to start with isometric bridges, where you actually go up into the position and just hold that for a period of time, rather than do the repetitive up-down ones. So usually, especially in cases where the tendon is quite sensitive, I get my patients to test isometrics of short holds first, and we'll likely start with their heels quite close to their bum. So feel the difference if you're on the floor and your feet are quite close to your bottom and you lift up. Now in this position, your glutes work harder than your hamstrings does. If you move your feet further away and do the same lift, you'll immediately feel your hamstrings have to engage in a different way and they've got to work harder. And the straighter your legs are, the harder they've got to work. And remember also, the straighter they are, cramp, the more compression there is there. So if you've got a bursitis, the straighter leg position is more likely to irritate it. So I may start my patients off with quite close to them and start with short holds. That would be the easiest. So 10-second holds, 10-second rest, 10-second hold about 10 times. If they can complete that easily, we'll increase the hold time. So we'll go to 20-second holds, 20-second rest, but maybe just 5 repetitions and go up from that. Now, you have a choice. You can make it harder through increasing the hold times. You can make it harder through moving your legs. You can make it harder through lifting the legs onto a chair even. When you have your feet on a chair, the hamstrings has to work quite hard again. So this is a good option. If you can't do the ones where your legs are straighter because it just irritates the tendons, then just lift your feet up onto a chair. Now, if you put your feet against the object that you're lifting on, it works in a different way compared to if you push down into it. Usually if you push down with your heels into it, it's harder work. So I often start my patients off pushing against it. Obviously then the chair has to be against the wall so it can't go away from you, and just lift up in that position and hold. And again, we'll build the holds up. And then I could get them doing it with straighter legs eventually, or I could get them doing things like marching bridges, where you keep your pelvis level and you just lift one leg up at a time. starting to load it in a single leg. Or you can start doing single leg bridges, where you lift all the way up and all the way down. So we're getting movement now and just building that strength. Now, if somebody is someone who just likes being active, wait, let's see, let's start with the least active person. So if somebody has developed lower hamstring tendinopathy because they have had a knee replacement and they don't really do sport, they just like to walk around and things like that, and they're not that flexible, I would likely stick to bridges just down on the floor level, and not even that many. You will likely work onto single leg work, but over a long period of time, but that may be enough for them because that's the strength they need. However, if it's a runner and just a regular person who likes to keep active, I'll work definitely up to where they can do about 3 sets of 15 single leg high bridges, going up and down. If it's your higher level athlete, they would have to do that with quite a straight leg towards the end of it as well, and perhaps even extra load on their stomachs. So it really just depends on what load is needed for their tendons. An exercise that I feel every single rehab plan for lower hamstring tendinopathy should include are leg curls or hamstring curls. Why do I feel that way? Well, 2 reasons. One, it's one of the few exercises that you can really isolate the movement to one leg at a time. And 2, it is also one of the few exercises where you can really work the hamstring through its full range of motion and focus on that slow eccentric control. Now, for tendinopathies, eccentric contractions has been shown to really help the tendon to repair itself better. So what's eccentric? It's when a muscle lengthens while it's under load. So if we think of the biceps muscle, if I pick up a weight, then that picking up action, my muscle is shortening as I pick it up. That's a concentric movement. If I lower it down slowly, the muscle still has to contract, but now it's actually lengthening as it's doing it. And that's the eccentric contraction. For the hamstring curl, moving the heel closer to the bottom is the concentric contraction, and lowering down slowly is the eccentric contraction. Now, there are many ways in which you can do a hamstring curl. You can do it with using stretchy bands, TheraBands, or you can use the gym equipment at the gym, or you can use ankle weights. I don't like the TheraBands or the resistance bands much because it's difficult to control the resistance through range. As you bend the leg up, the resistance actually increases because there's more resistance, you pull harder on the band. And then in the outer range, it's very difficult to get it the equal resistance there because then it's a shorter band. But if it's all you have, then it'll do as well. The other problem is that you can get up to a certain level of resistance and then after that it's not that effective either. So I very much prefer, if somebody has the option of getting into a gym or using weights, I would always get them into the weights using a machine in the gym for this. When you do get to the gym, you'll see that you can either do it lying on your stomach or you can do it sitting in like a chair-like position. Now, the lying on the stomach one may be least aggravating to start with, but it's a good idea to progress to doing it in the sitting position eventually, because that is actually going to mimic how you run with your leg flexing up, your hip flexing up in front of you and extending the leg. So it's a good thing to progress onto that eventually. Now, when we think of doing the movement, it doesn't matter how quickly you bend the leg or curl the leg up for the concentric bit, but when you let it go so that you straighten your leg out, try and focus on doing it really slowly and with control. The other thing that can be useful at the beginning is that if your hamstrings are quite sensitive to that last position where the leg is nearly straight because of the compression there, then stop short of that. So stop at 45 degrees or 30 degrees at the beginning and don't straighten your leg all the way. Let me show you what I mean. So if you're doing the prone one where you're lying on your front, it will mean that when you bend your leg up, you bring it up and then you just let it go down to that position and bring it back up. So you'll just stay in whatever position is comfortable for you. And you could even place cushions or a foam roller or something there to stop your leg from going fully straight. if you're doing the hamstring curl machine where you're sitting in the gym, now the weight would be underneath there and you'd be pulling it down and then you'll slowly let it go. And again, you want to stop around that angle at the beginning to not irritate the tendons too much. But you can work into a straighter position towards the end, although all the way straight is not really needed, just a little bend there. The only problem with the gym machines is that often their weights are too heavy at the start to start with a single leg. If that's the case, use double legs first and perhaps even start with just the weight of the machine that you don't put extra weight on. Build it up to where you can do a decent weight with 2 legs, then reduce the weight all the way back down and start with a single leg. That's how I usually get my patients strong enough that they can actually go onto single leg ones. Also, another option is that you take it up with 2 legs and then take your uninjured one off and just let it lower down the eccentric movement with your injured leg. So ways to progress this is obviously going from double leg to single leg, also going from a lightweight to a heavier weight, and then also working straighter with the leg. And if you're in the position where you're sitting rather than where you're lying on your front, that works the hamstring in a more lengthened position, because then it's also stretched over the hip before you then stretch it at the knee. If you just don't have access to a gym and you've gone through the TheraBands and they're not strong enough yet or anymore, then a way that you can make it harder for yourself at home is use a big exercise ball and do curls on your back, where you actually go into the bridge position and push your legs away from you and bring it back in. So it's that slow pushing away, that's the hard part, and then you curl it back in. Now with this, you can do it on 2 legs to start, definitely, because we've also got the balance issue here, so it's a much harder exercise. And then you can progress to doing it on a single leg. What I have found in the past is that double leg is often enough for people, and some people, when they go into single leg, just because of that unevenness of the ball not being that stable, it always irritates their tendons. So it's better in that case to just stick to double leg and do more slow repetitions, even if you want to put a weight on yourself, rather than go onto single leg, because the instability usually just irritates it. Now, I should also say, I have written all of these exercises out with examples in a blog post before, and I'll put a link to that blog post in the description of this video if you want to see it all written down. Then the third movement is Romanian deadlifts. What this develops is the hamstrings control at the pelvis, but also its eccentric function and also stability at the knee. You may find, if your hamstring is very irritated, that going all the way down can really annoy it because it stretches it and compresses it more. So I usually only start these a little bit later into the rehab, when I know that the tendons are a bit less irritable. And I usually get my patients to just start without weight and go through the range of motion and see how that goes. So we're starting without weight, doing 3 sets of 10 or 12 and checking the 24-hour response. Then we'll start with the light weights and double legs and just go down to that. Now, you're not meant to go there. That's not a deadlift anymore. That's too far. You only go to where you can control it through your hips. So that's my range of motion, just below my knees, and go up. But there's benefit in it if you don't go all the way and you just go to where you can control it without aggravating your hamstring. Then yes, once you've got good strength with that, you can move on to single leg ones and just do it on a single leg like that. But that is quite unstable again, and I find not everybody's tendons can handle the instability there. So you often can't load it up that much because of the instability. So if you're looking for pure strength, I would stick to double leg and just really load them up rather than go onto single leg. But of course, if you're at home and you don't have heavy weights, you're going to have to go into single leg. In that case, hand on the wall, because we're not doing this for the balance, we're doing this for loading up. So stabilize yourself in a wall that you don't go all over this space, and that you can then do it in a more stable way. Our bodies work like kinetic chains. And what I mean by that is that every single muscle has a job to do as we move. So for instance, when we think of the muscles that pull your leg back and propel you forward, it's the glutes and the hamstrings has to pull them back. Your hamstrings have to help stabilize your knee and also help propel you forwards as you run, and your calves have a job there. And your hamstring helps stabilize your pelvis, but the other muscles important for stabilizing the pelvis are your adductors as well as your core muscles. So if any of those muscles aren't as strong as they should be or not working as well, then more work will be expected from the hamstrings, and that can lead to them overworking. So it's really important, if you're not a sports person and you don't do heavy activity, that's less important. But if you are a sports person who likes to run or jump or just do high volumes of walking, for instance, then it is important to look at the other muscles in the body as well. And for the hamstring, it's definitely the core as well as the glutes as well as the calves are the main ones that I would look at. Exercises to avoid: hamstring stretches. Now, often hamstring stretches are one of the exercises people get prescribed purely because the hamstrings can feel so tight and uncomfortable when they are injured. But the problem with doing a hamstring stretch is that it also compresses the tendons and stretches the tendons close to the bone. And that often just irritates it more, especially if you've got a bursitis as well. Stretching can feel really satisfying in the moment, but then it often causes pain several hours later. So if you've got hamstring tendinopathy, I would really say don't stretch them during the early stages. Once you can do deadlifts through their full range, you can usually start stretching them. But rather use foam rolling or massage gun or something like that to relax your hamstrings than doing pure hamstring stretches at the start. If you are doing stretches and you find your hamstrings just keeps on being uncomfortable, see what happens if you stop the stretches. Often that's enough to actually help it calm down. Something else that's worth testing for, and any physio can test this for you, we even test it with our online patients, are for neural tension, increased neural tension in the sciatic nerve. Now, what is that? So our nervous system is continuous from our brain's spinal cord to the nerves that runs into your feet and your hands. So as we move, the nerves are made to slide. Now, sometimes something prevents the nerves from sliding freely. So instead of sliding as you move, they get stretched, and then they can cause discomfort and pain and contribute to injuries like these. And there is evidence that if somebody has had lower hamstring tendinopathy for a long period of time, that can sometimes affect the branches of the sciatic nerve and just stop them from sliding so freely. And often you then have to also add in stretches and exercises for the nerve to help everything recover properly. So this is definitely something your physio has to test for, and it's easy to fix. It's not a serious thing, but I've done a detailed video about how to test for increased neural tension in the sciatic nerve before, and I'll put a link to that video in the description of this one, because otherwise this video is just going to be too long. If you are found to overpronate, that's definitely something worth correcting, because overpronation is our feet normally rolls in as we walk and run and everything, and that's normal, it's not a problem. But some people have feet that roll in too much. Now, this overpronation can be caused either by weakness around the hips, so the muscles higher up aren't keeping things stable and then it overloads the foot, or it can be purely that the foot has decreased stability. Sometimes the ligaments aren't as good as they should be and just allows the foot to roll or to collapse. Depending on what is driving your specific case of overpronation, you may have to do something differently. So if your physio assesses you that it's a weakness around the hips, they may give you strengthening exercises for your hips. If they think that actually it's a structural thing with your ankle, they may advise that you get orthotics. So go see a podiatrist and get some orthotics that stops your foot from rolling too much. Often it's a combination of the two you should use. Some people don't need orthotics, they just need strengthening, but others, because the ligaments aren't as strong as they should be, can't get away without orthotics. They really do need them. So this is something that's worth assessing, but only treating if it's really needed. Now, if you're doing all the right things and you're not really making progress, then Shockwave is something you can consider. The research with Shockwave is a little bit hit and miss. It shows that it works for some people with tendonitis or tendinopathy and not for others. There's no specific studies looking at distal hamstring tendinopathy yet. In my own experience, is exactly the same. It works for some people really well, others it doesn't make a difference. What I find though is that it has very little risk. So if you're not progressing, it is something I would try to see if it can kickstart your rehab process. Something else you could consider using are injections. Now, there's different types of injections people use. So the flavor of the month seems to be PRP injections, which stands for platelet-rich plasma. Those are the ones where they take your own blood and they spin it to get your platelets and they inject that into the tendon. And the thought is that it regenerates or helps kickstart the healing process. It's also been shown to help for pain a bit. Now, the research with regards to PRP, sometimes it shows that it works really well. Other studies find that it doesn't really have an effect. So we don't quite know yet, but I have had patients who reacted really well. I've had ones who just didn't have any effect from it. So again, it's something to discuss with your doctor and see if it may be an option for you. It works for some, it doesn't work for others. An ejection that I would avoid is anything with corticosteroids. So corticosteroids have been shown to really be brilliant at reducing pain in the short term, but then it has a negative effect on tendon healing in the long term. And actually, you may be worse off a year later if you've had a cortisone injection. It's worth saying that if you have a bursitis and the bursa doesn't want to calm down through anti-inflammatories or load management, then a cortisone injection into the bursa itself may be an option, and that can work. But your doctor will do that under ultrasound guidance because they don't want to put the cortisone into the tendon. It's when you inject the tendon that is really not good for it. Injecting it into the bursa can be useful in specific cases. Lastly, surgery is an option for some people. There is always a certain number of people who just don't respond to rehab and who can't get relief for it. The idea these days, or the recommendation, is that you should try rehab for 12 months first before you consider surgery. And the reason for this is plainly that tendons take a very long time to recover. So if you've done your rehab properly and you've really made sure that the load management was right and the exercise choices were right, and that you tried a very gentle approach going into it, and you're not finding relief, then there is evidence that surgery may be useful. Brilliant. Hope you found that useful. And remember, if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.